We feel it's essential that the lessons of the pandemic are learned, and that all countries, all health systems, all health ministries invest in public health, a skilled multidisciplinary workforce capable of adapting and responding to every major threat to the health of the people that we serve.
Although many people will think, oh, well, we've had a big pandemic, we're fine now for a few more years, the frequency of travel, the intermingling of populations mean that actually it's quite likely that other pandemics will come quickly and more rapidly. And a reality is that we often sort of panic and then forget, and we need to break that cycle of responding rapidly and throwing huge amounts of money at current problems and then moving on to the next challenge.
I think everyone's doing their national soul searching. That's not only in developing countries, but also in the high-income countries. There, you can see that there's a lot of news, a lot of analysis.
So the great lessons is like we need to really concentrate and fund the health systems and of course the workforce that actually perform the essential functions of public health. We need to come together as partners, as contributors to the same objective that we all have.
We need to do better. We need to understand more, and we need to go further than we have before.
Such a pleasure to host you all, to really look at not only the systems readiness, but also the workforce readiness to deliver on our commitments, but to really put public health and the essential public health functions back at the core of the discussion.
Every country needs the capacity to be able to respond to an emergency, whether that's an outbreak of disease, a national humanitarian disaster, a national climate disaster, or any other critical incident. And to have those capacities, we need to bring knowledge, but we need to bring practice to get that done. What we've seen with this pandemic is that it can quickly impact the whole world if we don't have those capacities and those continuous competencies updated to be able to respond.
When we have a set of population needs, we then need to translate it into action. And so that will start first with high-level policies and strategies, but those are just pieces of paper at the end of the day. You need that workforce to deliver on them. So you need people who are at the coalface to understand what it is that their population needs.
The Public Health and Emergency Workforce Roadmap provides a pathway for countries to be able to focus on their public health workforce. And by that I mean disease surveillance, disease response, things that are so important for preparedness in situations of public health emergencies so that we can prevent or mitigate the next pandemic.
The goal and vision of Public Health and Emergency Workforce Roadmap is to ensure every country have a strengthened public health workforce, including their delivery of public health functions and emergency preparedness and response. Essentially, the ultimate goal is to protect health security, achieve universal health coverage.
The roadmap has identified 3 interrelated and interconnected action areas. The first is looking at what do we mean by public health functions. So we call them the essential public health functions, the very basic of what we need to do to give a nation a healthier population. And then we move on to the second action area, and you begin to see the interconnection here, because by looking at the essential public health functions, those critical functions, we start asking ourselves the question, what are the skills and the competencies do we need to have in place to be able to deliver those essential functions? And then the third aspect of the roadmap, and you begin to see the real interconnection, is really thinking about, right, so where are the gaps? So we know what the functions are, we know what the skills and the competencies are, but do we know exactly how we're doing along those? So it gives us an opportunity, the third action area, to be able to measure and map where we are based on the essential public health functions and the skills and the competencies that's needed, so we can drive improvement at a national level to deliver that better health for our population.
So context is everything. So every country has its own sort of challenges, and every country will have its own sort of scale of workforce. They will have potentially trained in different ways. So increasingly, if we want to work effectively as a global community, we do need to begin to standardize definitions to identify which health workers do what, or what essential functions need to be delivered. So all countries start at a different starting point, but all countries are on the same journey, but maybe at a different stage in it. So I think there is a menu or a repertoire of different interventions, and people will gradually move through a scale of interventions depending upon the level of sophistication of their health system currently.
In simple terms, it's a systematic approach to understand and profile the workforce, identify the gaps in the workforce capacity, and then use this information for the planning and then the policy development.
I think it's long overdue. We in academia are committed to making sure that the public health workforce roadmap is brought to fruition, because it is going to be a guiding document for us to improve on training and also to improve on education.
Discussion was about external measurement versus internal. Diversify.
I think that we need to really concentrate on what all of us bring to the table together, because some countries have a lot of resources, some countries they don't have anything, some have a few. Some of the countries also are replicating what other countries already have. So if it's a collective, we come together and we share whatever we have and we construct ourselves together, the gaps that we have, we're going to be better off. We're going to empower our workforce around the world.
Perhaps we need to look at the shared resources of the public health professionals. So we might need to have a think about that.
For many of us, we believe that the public health functions, they can be a very nice meeting point for the interprofessional education. And there are a few examples in the Americas that they can be, a good example for other regions.
We don't need to throw out what we already have in terms of training for public health professionals. We have gaps, however, in how we do that training and how we implement the knowledge that we give students and the alumni in the workforce. Those gaps were revealed through the COVID-19 pandemic. Many of them have to do with working across the health professions, urban planners, environmentalists, and we need to rethink how we train our students to make sure those gaps are filled.
With this roadmap that we are developing or co-developing with the WHO, we understand that health historically, for whatever reason, has been defined to a single sector. It's been siloed, it's been isolated. And when people think about health, they just think about disease and cure. They don't think about anything else around that. What are the social factors that determine your health status? What are the economic drivers that determine your health status? And what we want to do with this roadmap and what we want to see happen is this linkage.
There is a huge range of stakeholders that are critical to successful implementation of the roadmap, starting with those that are in positions of leadership for public health, starting with national public health agencies, but also normative bodies like WHO and the International Association of National Public Health Institutes.
There's a lot going on in terms of education for emergency preparedness, but I think the key is to focus on competencies and to make sure that they have a clear function that they're going to work towards, and that they also have the tools and the competencies that they need to work on that. So I think it's making sure that our education is fit for purpose as well.
For me, I kind of reflect back on how I got interested in the roadmap and how I kind of landed on it, because we'd done some research across the Pacific Island countries, and really I'm trying to understand what these countries had learnt through the pandemic, what the needs were to kind of promote health security or better response to infectious diseases, threats and acute public health events. So we did a big research project around, we brought together Pacific leaders and Australian leaders and I guess health systems leaders, and we ran a few focus group discussions. And what really came out was really surprising, not unexpected, but surprising, that health workforce was the strongest theme across all our focus group discussions. And people were like, we need to invest more in the public health workforce, and we don't really know who does what. So that really led us to kind of thinking about what is the next step. We saw this roadmap get launched, and it was really a perfect tool for us to kind of start thinking about, if we want to do this review, can we use the roadmap to, I guess, map out or conduct this review to really understand who does what and what the numbers of that are, so people can think about what the future of public health workforce looks like and what training we provide to strengthen the public health workforce. Who do we bring in? Do we focus on doctors alone? Do we need more public health professionals, so Masters of Public Health graduates in the Pacific? Do we bring in nurses? Who's going to perform the functions? I've been in countries supporting their COVID-19 response plans, and countries had never brought in environmental health officers, but it was a perfect example when we had to do points of entry screening. They were the perfect people to be surged in, but it's not a traditional role that they would have played. And I think understanding that and working with the roadmap, defining the functions, and then kind of looping back into the competency-based framework, I think is really exciting. So I feel like it's going to bring together a lot of things. It's big, but hopefully we can break it down into achievable chunks.
It's not a matter of why, it's a matter of how much we should invest in public health workforce. Public health workforce is essential for any health system and any parts of the government outside the health system, which basically exists to protect our health. It's a great opportunity for governments around the world to invest in public health workforce, strengthening their public health function, strengthening the research capacity, strengthening the ability of this workforce to respond at all levels.
Everything we do here is because we really need healthier people, healthier world. It's a constant reminder of the focus that why we're doing this, where we're going to find more common ground.
The roadmap that we have developed with partners deliberately looks at how do we link the evidence base to the political discussions and the diplomatic discussions. This roadmap is the opportunity to bring our evidence base, our baseline, and the actions that should be taken forward into those deliberations at the head of state level.
In Africa, we have the political commitment to drive this forward, and I think the South African President, Cyril Ramaphosa, have demonstrated this already. And also, African CDC is in full support of the roadmap. And I'm sure that with their support, we could sell it to the African continent through AU. I'm sure that there will be more political leaders who will support this and help bring it to fruition.
Our regional committee adopted a resolution on building resilient health systems in the Eastern Mediterranean region. And one of the emphasis in that resolution is also to strengthen essential public health functions in the region. This roadmap and our ongoing work will allow us to respond to this resolution.
investing in both the healthcare workforce and the public health workforce is critically important for securing the health of whole populations, and that's populations of all ages, of all nationalities, of all political persuasions. Everybody needs good health, and access to health workers is vital.